Welcome to my channel, Hairlicious. If you guys are new to this channel, my name is Aaron and I had 1,700 grafts implanted into the frontal portion of my hairline in South Korea in November of 2016 to lower my hairline and fill in some receding areas from the temples. As some of you guys know, I have been on vacation in Vietnam and I finally came back yesterday and just had the most amazing time. The culture, the food, the people, I even got this haircut here, were just phenomenal. And if you guys have never visited Asia, I would highly recommend Vietnam. To just go ahead and just take a vacation. Everything was so good. But now that I'm back, I am ready to go ahead and create more hair loss content for you guys. And so today I wanted to discuss the topic of dutasteride, also known as its brand name Avodart. And I realized that I did talk a lot about finasteride in my videos, but I never really dove into the topic of dutasteride. So you guys are already aware that finasteride is a type 2 5-alpha reductase inhibitor that is FDA approved in the US for hair loss and also for enlarged prostates. And it's pretty effective when it comes to slowing and possibly reversing hair loss, genetic hair loss. We do know that type 2 is the predominant enzyme in the prostate and the outer root sheath of the hair follicles and the dermal papilla. So studies do show that over 80% of men who are taking finasteride stop losing hair, and about 65% had hair regrowth after 2 years of using finasteride. What we do know is that finasteride works in the majority of users, and as a user myself, I was able to slow down further recession, and I have not seen any recession after over 2 years of having my very first hair transplant, as you guys can tell. Now, the other thing on the flip side of the coin is that we also are aware that finasteride can come with various side effects. Most of them are affecting the sexual performance, such as low libido, watery semen. Some people do have cognitive functions that are impaired, such as brain fog, depression. Some people also do show physical signs such as breast enlargement. Studies show various percentages in people who do experience adverse side effects or reactions. Some studies only indicate that 2 to 3% of people are suffering from side effects, while other studies indicate as much as 10% or even higher. But based on personal experience and from talking to doctors and from just reading things online, the side effects are real, but it's just such a small percentage of people who do experience side effects that relatively finasteride is a safe and effective treatment for controlling male pattern baldness. And that is reflected through many studies, many long-term studies, some as well as 10 years, 15 years. But you do have to realize that there are side effects of people that do experience these side effects. And there's also other groups that try to scare people, potential users of using finasteride. So keep that in mind. Sometimes people that want to take finasteride read about side effects and it kind of lets them get to their heads. It's also known as the nocebo effect. And a study was actually done on this where patients who were informed on the sexual side effects along with other physical side effects of finasteride had a significantly higher proportion of sexual dysfunction in patients when compared with patients in which the same information regarding the side effects were omitted. So the burden of the nocebo effect has to be taken into account when managing finasteride or dutasteride side effects. Like I said, this doesn't mean that side effects don't exist because people do experience them, but for the majority of the users, they are not going to experience adverse side effects. So the topic that I wanted to cover is another known 5-alpha reductase inhibitor that works even better than finasteride, and as you guys know, that is dutasteride. Dutasteride is a dual inhibitor of both type 1 and type 2 5-alpha reductase, and although type 2 5-alpha reductase enzyme has a more significant role in genetic hair loss, the predominant enzyme in scalp skin is type 1, largely because of the localization to the sebaceous glands, which are plenty in the scalp. And since dutasteride targets both types, it's more of a souped up version of finasteride, and it works obviously better than finasteride for the treatment of hair loss. The only problem with dutasteride is that if you guys are living in the US, it hasn't been FDA approved for hair loss. Although it is used for the treatment of enlarged prostates, but doctors are not going to be able to prescribe dutasteride for the treatment of hair loss unless it's going to be for off-label. But dutasteride is approved in South Korea and Japan for treating hair loss. And when I had my hair transplant in Motion Clinic back in November of 2016, the doctor there actually prescribed me 0.5 milligrams of dutasteride. I did not take dutasteride because when I came back to the US after my hair transplant, I went to my local dermatologist to get a prescription of finasteride instead, because as you guys can tell, my hair loss wasn't severe. I was at a Norwood maybe 2.5. And I didn't want to start something that was stronger than finasteride, because if I can use something that's less potent with good results, then I would start off with that instead of starting with something stronger. So that's the main reason why I started finasteride instead of dutasteride. And I actually did some research on dutasteride users in South Korea to look at the safety and tolerability profile in users. So dutasteride 0.5 milligrams was approved for use in 2009. And a study that enrolled over 700 subjects was evaluated, and they found that about 15% of the subjects had adverse side effects, obviously mostly being sexual side effects, but the majority of the dutasteride users had good results. Now, the reason for this is because obviously dutasteride blocks more DHT than finasteride. The side effects would obviously be higher. Now, another US study puts dutasteride side effects at under 5%. So studies do show that 0.5 milligrams of dutasteride surpassed over 90% of serum DHT and 54% scalp DHT, while 5% of finasteride only surpassed 70% of serum DHT and 38% of scalp DHT. So given the results, dutasteride is obviously much more effective in treating hair loss than finasteride. And a study also did show that dutasteride 2.5 milligrams gained close to 110 hairs, whereas men who are taking finasteride 5 milligrams only gained about 75 hairs. This also does mean that dutasteride is dosage dependent, since studies that tested different dosages of dutasteride ranging from 0.1, 0.5, all the way to 2.5 milligrams showed that the highest dosage yielded the most hair growth. And if you guys know Ashton Kutcher, he also took dutasteride for the past 10 years when he was 25 to 35 years of age. And he attributed dutasteride for slowing down his hair loss. But he did say that he stopped taking dutasteride and that his hair loss has continued since he was off the medication. And that's expected because after time, finasteride or dutasteride is going to lose its efficacy. And if you guys do stop taking hair loss medications, it's going to continue your hair loss. And that's why it's called treatments and not a cure. He said he wasn't suffering from any side effects, but rather just decided to accept hair loss, and he didn't let it get to the better of him. So with that said, let's go and take a look at some before and after photos of proclaimed dutasteride users. First photo here is an Indian patient who was taking dutasteride 0.5 milligrams daily for 24 weeks. You guys can notice some pretty good crown regrowth and even on the mid-scalp regions. The next photo is pre and post-treatment global photographs of moderate improvement in patient with androgenetic alopecia at week 24 of taking dutasteride. So photo 3, this next guy is a Norwood 6, and he says that he has been a system wearer, and he's been on Propecia for about 2 years with no obvious benefits besides keeping his existing hair. So he switched to dutasteride 5 milligram daily, which is a pretty high dosage because the average is 0.5 milligrams. But the photos here represent the results. The before picture, as you guys can see on the left, and then you guys can take a look at the right photo here. The next one is a randomized study on identical twins where it compared the efficacy of dutasteride versus placebo. The twin received 0.5 milligrams of dutasteride for 12 months, and you guys can tell the difference between the left and the right photograph. So the next photos are patients who were taking dutasteride injections plus oral dutasteride plus 5% topical minoxidil at 12 months. So the results are pretty good, and the thing about these ones is that they're actually taking injections of dutasteride in addition to minoxidil, because minoxidil is a vasodilator and dutasteride and finasteride are going to be 5-alpha reductase inhibitors. So if you guys are taking finasteride or dutasteride, you also want to include minoxidil, because minoxidil is a vasodilator and finasteride and dutasteride are 5-alpha reductase inhibitors. So they actually have different mechanisms of action. So you guys want to use both to promote the most hair growth. Dutasteride is more effective and more potent than finasteride, and I don't think that dutasteride should be used as your first line of defense in treating hair loss, especially when we have finasteride that is very effective in treating hair loss for most men and with fewer side effects than dutasteride. So if finasteride doesn't work, dutasteride could be a last resort as it inhibits both type 1 and type 2 enzymes. But without any type of medication, people are going to respond differently, and that is why some people do respond to finasteride or dutasteride. And this is true because a 5-alpha reductase inhibitor is going to increase testosterone levels by anywhere from 10 to 20%, while it does lower DHT, but it also increases free testosterone. And since testosterone is still an androgen that is significantly less androgenic than DHT, it's about 5 times less androgenic than DHT. So If you guys are particularly sensitive to androgens, then testosterone is going to continue to cause miniaturization, and you are actually going to eventually start to lose your hair. And 5-alpha reductase inhibitors may not work for you, since you have all this free testosterone in your body that is still attacking your hair follicles. So that's why some people don't actually respond to medications. This is why my next video, I'm actually going to be discussing some theoretical and practical ways that you guys can actually reduce DHT levels in the body. So stay tuned for that. And if you guys are looking for a proven method to slow down hair loss without taking medications such as 5-alpha reductase inhibitors, take a look at my video on microneedling and minoxidil in the description box, and visit my website at hairlicious.com. If you guys are looking for a good hair transplant doctor, but don't know where to start, you guys can check out my ebook, which I've compiled 25 of the top hair transplant doctors, in my opinion, that I would recommend. As always, thanks for watching, guys. If you guys have any questions, please make sure to leave me some comments below, and I will talk to you guys next time. Take care.